This presentation is on an elder gentleman named Delbob who is currently seeking new hospice care. Delbob is 72 years old and he is Hispanic. He has one child and one grandchild. His grandchild is named Diego. He is the main care provider for Delbob. Delbob is currently receiving hospice for COPD and lung cancer. He's on a ventilator and he is a veteran and a Catholic. Part of the dilemma stems from Delbob's grandson Diego. The caregiver has some mental impairments, which makes him erratic and has been perceived as dangerous. The hospice center that is currently taking care of Delbob is the third that has worked with him. All previous cases state that Delbob was taken off services because the hospice crew felt like they were in danger when working with Diego. Diego has pulled weapons out during visits, even though he hasn't directly threatened any of the workers. He has talked about how he would do anything to take care of him and his grandfather. When this case was presented, we found that the RN manager really wanted to take on this case because Delbob is running out of options. Not very many hospices will work with him because he is at home and they feel like their crew would be put in danger. The RN manager, however, feels like where Delbob is on a ventilator, he needs to receive adequate care during his end of life. Another complication in this scenario is that the ventilator which is used isn't something that anyone on the hospice crew knows how to use. They don't know how to clean it properly, and the hospice doctor has let them know that he has not used one in a very long time, so they would need to find someone who could train them. The dilemma then is, should Delbob be admitted to this hospice with their inadequate services and the danger the staff may experience? When considering this case, we need to think about the patient and the staff. We need to know if it's ethical for the team to take care of the patient when they are incompetent with ventilators. We need to also think about the risk the crew is in and whether the risks outweigh the benefits. We also need to consider any other choices we can make that could not just help Bob join our team, but to help Delbob find another team that could care for him. When looking at Delbob's eco map, you can see that his home life, he has a good connection with his grandson Diego. His grandson and him take care of each other in many ways, and they have a close relationship. Delbob's other family lives in Mexico. He doesn't speak to them very often, maybe once a year. Delbob's relationship with his only child is very stressful and almost non-existent. There is very little communication with them. Looking at the hospice care, you can see that there is a strained relationship because of the dynamics with Diego and the old hospice, and the current situation and dilemmas with the new hospice. As seen on the eco map, Delbob has a lot of stressors, including his limited support, his limited hospice options, and family relationships, and hospice cares. Delbob does have a good support system with Diego. and he also has a good connection with the church. The priest does come out and visit him whenever he can, and they have a close bond. He also receives good services from the state. He gets veteran benefits, he receives food stamps, and Diego even gets paid to take care of Del Bob. While trying to find a good option for Del Bob, considerations of care facilities was brought up. However, Del Bob is from Hispanic roots, and his culture believes that families should take care of their elders regardless of emotional, mental, or physical dilemmas. Del Bob believes that his family care is the only acceptable answer. He also refuses to ask his grandson Diego to leave while hospice visits are taking place at his residence. He doesn't want to be moved to a care facility because he has family to take care of him, and that's very important to him. He knows that hospice care is there to help end of life be comfortable, and he feels that hospice should allow him to stay home with Diego's assistance. He feels that no other care would be as beneficial as the care he receives from Diego. When thinking about this case, rational choice theory was used because Del Bob mentioned that he relies on state care and state finances to help him, and he knows that hospice will be covered. He also knows that staying with his grandson allows not just him to be cared for by family and save some money by staying out of a facility, but he also knows that it gives Diego some sort of income. So it feels to him that it's rational to use all these resources in the most cost-effective way while also getting the care he needs through a hospice setting. When looking at it from a social worker point of view, we see that it is a rational choice for him to save money, but it's also irrational for someone without adequate knowledge to take care of him. Systems theory was also used, and this is because everything in Del Bob's eco-map shows us that they're playing on each other. Del Bob needs to receive services because he's at end of life and only has 6 months or less to live. He needs these services because he knows that not only will they be paid for, but they will help him in his home, and it'll make his end of life days a little bit better and more enjoyable. When you look at the systems theory, you can also see that the medical side, the home life, the hospice side, the resources, and the family all play together. And being able to get those to match up to where the care is adequate, the resources are adequate, and his support systems are adequate, all play together. And in order to get Del Bob the best care, we have to make sure all these align in the best way possible. To come to a conclusion, the code of ethics needs to be considered in order to help figure out where everything aligns. The Elaine Congress ethic model of decision was used. Here we evaluated many things, including his personal care, the agency's devotion to our clients, and what would conflict with those ethics and our mottos. We also thought about our professional values along with personal, because we felt like we needed to make sure if we took on this client, we are secure in both of those and that we would be able to give him the best care possible and that we weren't going to cause more harm than good. That comes down to the social work code of ethics. And if we're causing more harm, then it's not ethical for us to take him. While thinking about this, we hypothesized what are the possible consequences for taking Del Bob's case, including the harm it could cause our workers, the harm it could cause to him because we can't give him adequate care because of our knowledge on ventilator systems. We also had to identify the benefits. He would be able to quit looking for hospice care, and he would be able to have someone take care of him so he could continue to enjoy his end of life. And when we looked at that, we realized there was a huge issue with harm, though. No matter what way we looked at it, there was more harm that may be caused than good. And we also decided to go to the general manager and the CEO. When we went to them, we were able to come to an ethical choice together because we were able to put all of our different professional values together and come up with a decision. While using that ethic model, some of the things we considered was the strengths, which he has. Del Bob has a constant live-in caretaker. He has a way to pay for all medical costs. He has no rent obligations because Diego pays for the rent with the assistance he gets for taking care of Del Bob. Some of the limitations, unfortunately, is that his care provider causes friction with others. There's limited income. There is a lack of understanding on Del Bob's part as to why he's struggling to find more care. He's in a state of denial about his grandson, Diego, causing conflict and possibly being a harm to others. Because of this, there is some lack of trust in hospice. And so taking him on our team and not being able to take care of him would decrease his trust in hospice care even more. After using the A-Line Code of Ethics, the social worker finally came to the conclusion that it would not be a good fit for Del Bob to be on our team. It would go against the office's morals and their framework. It would also go against the social worker's code of ethics. This is partially because the lack of experience in ventilators is dangerous, and in order to find someone to care for Del Bob, it would have to be male caregivers because there's less friction with them and Diego. However, this hospice truly lacks the ability to alter enough caseloads that more males could step in and take care of Del Bob. We also realized that our incompetence could not only cause lawsuits, but possibly end up cutting years off of Del Bob's life because of infection and malfunction. Overall, Del Bob's only safe option is to be placed in a facility where he can be cared for, or to find a different hospice to care for him. Okay, so what would you do differently? What options can you find that might help Del Bob besides helping him find a different hospice care?